At the Everywoman clinic, we see a lot of patients coming with the problem of infertility, that is, inability to conceive. Of these, 50% of the problem lies in the woman. Very often, this problem is that of tubal block. The woman has two tubes around the uterus. If both of them are blocked, either from where they begin, which is a coronal block, or towards the end of the tube, which is a femoral block, these can result in infertility. The diagnosis is made with an X-ray or a hysterosalpingography or an HSG as it's called, or by means of a laparoscopically, where a telescope and camera is put inside the abdomen and the uterus with the tubes, ovaries are visualized, and it is proven that the tubes are blocked. Once the diagnosis is made, the treatment depends on the type of tubal block. If the tubal block is cornual, that is, the tubes are blocked just where they begin from the uterus, we can attempt a tubal cannulation procedure. In this technique, a hysteroscope or a camera is introduced inside the uterus as well as outside the uterus, and under vision, a thin guide wire is passed from inside the uterus through the tube to the outside. So by passing a wire through the block, this block is often opened, and this technique is called tubal cannulation. If successfully done, the patient can go on to become pregnant spontaneously and have natural pregnancies subsequently. However, if the tube is blocked at the lateral end or towards the outer end, this technique is not feasible, and then she has to undergo either laparoscopic surgery to open out the tubes at the lateral end, or she may have to undergo an open tuboplasty. However, if the tube is badly damaged, a tuboplasty does not give good results in terms of pregnancy, and the patient is much better off doing an in vitro fertilization or an IVF procedure. In an IVF procedure, even if the tubes are blocked, the patient can go ahead and become pregnant very comfortably because the tubes are completely excluded in this treatment. In IVF, the patient is given injections to produce a number of eggs, which are then removed with help of sonography. The husband's semen is taken and the eggs are fertilized outside the body in the laboratory. Once the eggs get life into them and embryos develop within 2 days, these embryos are then placed back into the womb through a small tube. As a result, the fallopian tubes of the lady are not necessary. So tubal block is a difficult problem, but now there are different solutions, specific solutions depending on the specific problem, and most patients with tubal block can become pregnant.